As the thyroid hormone is a crucial hormone in brain development, babies born to these mothers are more likely to have intellectual disabilities, as well as developmental delays if the condition is not recognized and treated soon enough. Now you see why I say that all women early on in their pregnancy, as soon as 6 to 8 weeks, should be screened for thyroid disease. Because a lot of women may not get any symptoms at all. These symptoms are all well and good if you recognize them, and sometimes they're non-specific. You might get 1 or 2 of these symptoms and you might not put it down, and your doctor might not be able to tie the knot and realize that you have thyroid disease. But if you do the blood test and you are screened early and you are giving the treatment that I'm just about to mention, then your baby can be spared of such a significant condition as intellectual disabilities and developmental delay that will impact that child for the rest of their lives. So really, I am a strong advocate that all women should have a thyroid function test early on in their pregnancy. Now, hyperthyroidism in the mother can cause significant problems in the baby. Why? Because if the hyperthyroidism in the mum is caused by Graves' disease, this can also lead to hyperthyroidism in the baby. And so when the baby is born, what will happen is the baby may have a fast heart rate, be irritable and have high-pitched cries all the time, as well as that baby having an enlarged thyroid when it's born. And so if it has an enlarged thyroid when it's born, whilst it's still a fetus in the mother's womb, it will be detected that the thyroid gland of that baby is going to be large. But ladies, if you have either of these conditions, no need to panic. It is very easy to manage them both. On to the management of thyroid disease. If you've been told you have hypothyroidism, your doctor should be prescribing levothyroxine. And this is an artificial replacement of the thyroid hormone that your gland is not making enough of. And your doctor should monitor your thyroid hormones by doing regular blood tests every 6 or 8 weeks, depending on what your levels are. And your blood test results should allow your doctor to adjust the dosing of your levothyroxine. If you have hypothyroidism in pregnancy, you should consider taking antenatal multivitamins that have an adequate amount of iodine. Because remember, the hormone is made on the basis of the gland uptaking enough iodine from the bloodstream. Hyperthyroidism, on the other hand, is managed with the anti-thyroid medication known as propylthiouracil. That's a mouthful. And this drug is used during the first trimester. And for the second trimester onward, the drug known as methimazole is used. But remember, I am not your doctor. I am a doctor on YouTube trying to educate the masses. So do not go by my advice. See your doctor who would tailor your management according to your clinical presentation. Again and again, when you have hyperthyroidism in pregnancy, you will need to see your doctor regularly, both to do blood tests to monitor what your thyroid hormone is, but also to monitor the side effects of the drug on the fetus.